Hello everyone, my name is Laika Jane Galang of BSN 212B from Double Doctors College. And for today's return demonstration, I will be performing female urinary catheterization. The first thing to do is check the doctor's order for catheterization. This is to ensure that we will be assessing the correct procedure to be done with the right patient. So I have already done that. Next is to wash hands before preparing the set. This is to deter the spread of microorganisms, which is I have already done also. Next is identify the patient and explain the procedure. This is to inform our patient of the things that we will do all throughout the assessment. Good morning, ma'am. I am Laika Jane Galang from Double Doctors College, and I will be your student nurse for today. May I see your wristband, ma'am? Alright. Can you state your full name? Okay. And your birthday? Your age? Alright, thank you very much. So, Panda, Miss Panda, how would you like me to call you? Alright, Panda. Okay, Panda. Now, I will be doing a female urinary catheterization. So, for you to relieve all the urine that has been stuck in your bladder and for you to be more comfortable. Alright, Panda? So, now, provide privacy by screening or closing the room. So, this is to respect and make the patient comfortable while doing the assessment. So, alright, I have already done closing the door and fixing the curtains, Miss Panda, for your privacy. Now, position the patient in the dorsal recumbent with the knees flexed. Alright, Miss Panda, can you flex your knees? Alright, thank you very much. Now, this position allows good visualization of the meatus for easy insertion of the catheter. Now, let's first prepare the urinary bag to make sure to place it before the waist level, below the waist level of the patient. Alright, now drape the patient exposing only the area to be used. This is for the embarrassment and chillness will make the patient become tense. So we don't want to make that happen. Miss Panda, I'm just going to get the drape. Alright, so I will be exposing your genitals. Miss Panda, okay? Okay. Can you please release your buttocks a bit? Okay. Thank you very much. Now, apply direct light for visualization of genital area. Having enough light may interfere with the easy insertion of the catheter. Now, open the tray and arrange equipment for convenience and accordingly to avoid contamination of sterile items. Placing the materials in order will increase the speed of the procedure. Reaching the sterile items will increase risk of contamination. Panda, I will be getting first my tools, okay, to set it up. Okay, now using sterile forceps, cleanse the area using cotton ball with betadine. Thorough cleansing of the meatus and the area surrounding it reduces possible introduction of microorganisms in the bladder. So first, open the set, like what I have already did. Then, observing sterile technique, put on sterile gloves. eye sheet on. Okay, we'll be putting eye sheet on your genitals, Panda. Okay. Now, lubricate using the catheter for about 1.5 inches, being careful not to plug the eye of the catheter. This is important because lubrication reduces friction and it reduces pain upon insertion. Now, pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb and one finger on the left of the right hand between the labia minora, separate and pull up gently. Separating the area surrounding the meatus provides visibility. Now, insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow. Female ureter is approximately 1.5 to 2.5 inches. All good. Now, if a specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in position. Urine will flow out of the catheter if lumen is not occluded. Next is to rest the hand in the pubis area while holding the catheter in place to prevent pulling and pushing of the catheter. This action prevents the possibility of contamination of the urethra. Alright, can I please to your pubic area, my hand to your pubic area, Panda? Alright, thank you very much. Now, connect the catheter to the urine bag. Okay. All good. Now, inflate the balloon 10 to 15 cc of sterile water using a 15 to 20 cc syringe to make sure there is no leakage of water from the balloon. Alright. And let me just place it here, Panda. Alright. Okay. All good. I'll be doing the next procedure, Panda. So, alright, we're all good now. Okay, now secure the indwelling catheter by taping it to the patient's thigh. Allow some slack of tubing to accommodate the patient's movement. This is to help the catheter to secure properly. catheter, Panda, alright? Okay, very good now. So let's proceed to the next procedure. So I will be getting the eye sheet. Okay. Alright, all good now. Alright, Panda. So let me just get the feet. Okay. Now I have already placed the patient comfortably. Now let's do the aftercare of the tools that I have already used. Right, now I'll be putting off my gloves. Record the time of procedure done, amount and color of initial output. And remember to sanitize and wash your hands every after the procedure. And that's all for my return demonstration. I'm Jane Galang. Thank you.